Lack of sexual interest may indicate an increased risk of an early death among men, according to a newly published study. Researchers speculate a reduced sex drive could be a more visible sign of subtle underlying health issues. The data came from 20,969 people aged 40 or older who had annual health checkups over a 6-year span in Yamagata Prefecture. A team of researchers from Yamagata University looked at the subjects' levels of sexual interest as self-reported in an initial questionnaire and in a follow-up survey conducted years later. Of the original 20,969 subjects, 503 had passed away in that time. The researchers found cancer mortality and all-cause mortality were significantly higher for men who reported a lack of sexual interest. That association held even when they controlled for factors including age, hypertension, diabetes, smoking, alcohol consumption, BMI, education, marital status, frequency of laughter, and psychological distress. Although sexual activity and sexual satisfaction are considered of benefit to psychological health and well-being in older groups, the association between sexual interest and longevity has not been investigated, the researchers write. This study is the first to prospectively examine associations between sexual interest and all-cause mortality and cardiovascular and cancer mortality in a community-based population. Maintaining sexual interest just might yield positive effects on longevity. Despite the study's limitations, the researchers argue in favor of raising awareness of sexual interest as a factor in public health among older populations in Japan. The Canadian government, through public health promotion materials, has begun to endorse sexual activity as one element of an aging well agenda.